First time I heard about HPV was when I was a young girl. A pap smear checks for abnormal or precancerous cells. Hello everyone, I'm Dr. Busola Ayelowo, the Chief Medical Director at Medics Partners Multispecialist Hospital, and I'm live with BellaNaija. Let's talk about HPV, how it leads to cervical cancer, and everything women's health.
Hi, Dr. Ayelowo.
Hello BellaNaija.
How are you feeling right now in one word?
Awesome.
Awesome, amazing. Okay, so introduce yourself and take us through your career journey.
Hello BellaNaija, I'm Dr. Busola Ayelowo, the Chief Medical Director at Medics Partners Multispecialist Hospital. Why did I become a doctor and how has my journey been so far? I've always wanted to become a doctor. I've been a very curious child, or was a very curious child. I've always cared about people, and for me, one thing that struck out was I always wondered why people suffered from things that they had no cause or had no control over. So for me, diving into medicine was out of curiosity and a passion to help people.
We're talking about HPV, and BellaNaija's Stop HPV for Her campaign is to raise awareness about HPV and cervical cancer, because these things are preventable, right? So when was the first time you ever heard about HPV?
First time I heard about HPV was when I was a young girl. My interest in medicine made me do a lot of reading and a lot of research quite early in life. So my first encounter came while I was doing some internship at a hospital, and they had asked if I'd ever been vaccinated against HPV before I could come in contact with patients. So I think that would be about maybe when I was about 10 years old. And while I was at it, it was just fascinating for me to know about reproductive health and the importance of early detection, which shaped how I took women's health forward and how I am actually in forefront of women's health now in terms of my career.
That's very impressive. I don't think I ever heard about HPV when I was 10 years of age. But imagine my surprise when reading about HPV, I realized, like many other women, that it is pretty common. Why is HPV this common?
HPV is one of the most common types of viral infection worldwide because it spreads through any type of damaged skin. And one peculiar thing about HPV is that almost everybody will come in contact with HPV without knowing, because like we all know, some types of HPV come and then they survive in the body for a some period of time and go. So most adults will come in contact with HPV and never know about it. And it's gaining a lot of attention now because there's a lot of awareness about its relation to cancers, different types of cancers.
So how are most adults exposed to it, like at some point?
Most adults will encounter at least one strain of HPV. In fact, majority of infections clear up on their own without any symptoms. However, persistent infection with certain high-risk types leads to cervical cancer and other cancers, which is why awareness and prevention is very important when it comes to HPV.
Also, I'm talking about prevention. A big part of your medical career focuses on wellness and preventative medicine. Tell us about some steps women can take to prevent HPV and then the progression of HPV to cervical cancer.
Prevention starts with awareness and proactive habits. I would always say get vaccinated. The HPV vaccine is one of the most effective ways to prevent infection with high-risk strains that can cause cervical cancer. Regular screenings like pap smears and HPV testing will detect early cell changes before they become cancerous. Safe practices like using barrier protection and limiting intercourse with different people reduces the risk of exposure. Healthy lifestyles like boosting immunity through proper nutrition, exercise, and quitting certain kinds of habits would also support the body to a healthier system.
Dr. Busola, tell us, why is it important for people to know that HPV causes the majority of cervical cancer cases?
It's important for people to know because knowledge drives action. When people realize that a single preventable virus like HPV causes majority of cervical cancer cases, it changes the narrative from fear to empowerment. It also helps women understand regular screening and that vaccination is also not an option, it's the only way out. It's a life-saving step that can protect future generations of women.
Dr. Ayelowo, as a medical doctor and as a parent, what are your thoughts on the HPV vaccine?
As both a doctor and a mom, I strongly support HPV vaccination. It's safe, it's effective, and has been proven to save a lot of lives. The fact that the government now offers free one-dose HPV vaccine for girls aged 9 to 14 across primary health centers is an incredible step forward. Vaccinating early before exposure gives the best protection. And as parents, we should take advantage of this opportunity to safeguard our daughters' futures.
So we heard that HPV has many strains, and you mentioned the one-dose vaccine given in Nigeria. What strain does this particular vaccine cover?
Yes, the single-dose vaccine used in Nigeria provides protection against the most dangerous type of strain, which is the type 16 and 18, which is typically responsible for about 70% of cervical cancer cases globally. Depending on the specific vaccination formulation, it may protect against other strains also.
Interesting. So we see you advocate for, routine cervical screenings like the pap smear very regularly, and for this campaign, we've been talking a lot about pap smears. What makes pap smears very necessary? And when should people start doing their pap smears? And how often should they?
Cervical screening is one of the simplest yet most powerful tool we have for preventing cervical cancer. I recommend starting pap smears at the age of 40 or earlier if there's a strong family history or there's a risk factor such as HPV infection. Screening is usually done every 3 years or as advised by the doctor. Screening allows you to detect abnormal cells early enough and long before cancerous ones develop and intervene promptly.
A lot of people get confused between HPV test and pap smears. I would really like us to, talk about the two right now. What is an HPV test and what makes it different from a pap smear?
Oh, that's an interesting question. A pap smear checks for abnormal or precancerous cells on the cervix, while the HPV checks directly for presence of the virus itself. Both of them are very valuable, but the HPV test identifies women with high risk, and the pap smear shows whether their virus has already been deposited in the cervix and has already started changing the cervix. Combining both of them together is a comprehensive picture for a cervical health screening.
Interesting. So this means that early detection actually saves lives.
Absolutely, early detection saves lives. Most cervical cancers are completely preventable when detected at precancerous stages. With routine screenings and prompt treatment, survival rates are extremely high.
Interesting. Let's talk about pap smears. We've registered that they are super important, but then a lot of women are usually very shy, to go to the hospital, talk about pap smears. They are usually embarrassed by symptoms of, let's say, HPV or cervical cancer. What will you say to women like this who feel shy about getting screened?
I would say that don't let shyness cost you your health. Early detection saves lives, and you can never go wrong by taking that step. Your doctor is here for you to help you, not judge you. A few minutes of mild discomfort can prevent years of pain or even save your life in general.
So we have been hearing about how men are, being affected by HPV as well. Tell us about this and how men can also prevent HPV or HPV related cancers.
HPV doesn't only affect women, men also are carriers and can transmit the virus. In most cases, it causes genital warts, cancer of the throat, penis, and anus. Men can protect themselves and their partners by practicing safe sex, avoiding multiple intimate partners, and supporting vaccination programs. Awareness amongst men is equally vital because prevention is a shared responsibility.
I have just one more question for you. So some countries like, the US, the UK, Cameroon, they vaccinate boys for HPV too. Should Nigeria join this list and why?
Absolutely, yes, Nigeria should join the list. Nigeria should absolutely move forward to vaccinating boys as well. Vaccinating boys help reduce overall transmission of HPV, protecting them directly from HPV-related cancers. It also contributes to a herd immunity, creating a safer environment for everyone. HPV is not a female virus. It's a human virus. Protecting both genders ensures a healthier and more resilient population. Hello everyone, it's Dr. Busola here. Ladies, let's get tested. Know your numbers. Get your HPV testing today. Do your pap smear. Let's take and make sure our health is our priority. Together, let's stop HPV for her.